Hi everyone. I have the deep pleasure of speaking to Alexis today, who is a radiant example of the inspirational capacity for a woman to heal herself. I had the auspicious opportunity to meet her in my Kundalini yoga teacher training and just got a little window into the process that she was in the depths of, really. And so I want to share her experience, not only because it is an example of the potential to totally shed disease labels, but also because it's an example of how we have the opportunity and ability to do this really completely on our own. And we're in an incredible time for self-initiated healing. And to be clear, she's not a patient of mine, and she's going to tell us a bit about what it is that she was able to move through and the process that she was able to engage even in the past couple of months. So tell us where you're coming from, Alexis, and give us a little bit of a window into it.
Okay, so yeah, I met Kelly, I guess it would have been back in October of 2016. So hard to keep track of the years.
I know.
So yeah, at the beginning of our teacher training. And at that time, actually October, I had just celebrated 5 years of sober recovery from drugs and alcohol. And at the time that I had started working on getting clean, my doctor had also simultaneously put me on antidepressants. So I had also been on those for about 5 years. And I was at the point thinking, I wanted to dig deeper as far as trying to find myself. And I was feeling like being on those pills, I never really felt so depressed, but I also never really felt joyful or happy. I didn't really have any emotions. It was kind of just very even feeling all the time. And I had also gained a lot of weight. I was feeling really self-conscious in my body. And I wasn't even sure if that was because of the antidepressants. But I felt like I just wanted to start to get off of things that I was taking to just reconnect more so with myself.
And what were you taking, just so people have a sense of where you were?
So I guess, I'm not sure. My doctor tells me it was a low dose. I don't know if that's true, but I was on 20 milligrams of Celexa.
Okay.
Yeah.
And for a couple of years, or for?
Yeah, almost I guess about 5 years, because it was pretty much right at the same time as
Right.
when I started seeing him to get clean off drugs.
And so this, to me, is a fascinating element of your experience, because it's sort of, in my opinion, a bit of a dirty secret in the guild of psychiatry that we have sort of protocolized shifting dependency from illicit substances to regulated prescription substances that, in my opinion, are actually potentially even more habit forming.
Mm-hmm.
And it's really sort of what's done, so we aren't really giving people an opportunity to look at, as you've referred to, the root cause of what was driving your initial addiction. If you weren't encouraged to do that, but instead you were sort of shuffled right into the psychiatric, mill, so to speak, and started on medications that kept you divorced from any process of self-exploration,
Mm-hmm.
right? Isn't that just sort of just another way to prolong your process?
It was just putting another Band-Aid on top of the problem.
Right. So somehow you had the sense that you wanted a different experience. That's, at some point you were on medication, you were sober, and you had the sense that there was more for you. Can you just speak to how did you know you wanted to even come off medication?
I would just kind of think is this all there is to life? You just wake up, just get through the day. And I just felt like I wanted to, even if it was experiencing sadness and crying and being frustrated and mad over things, I just wanted to feel something. I felt like I was just feeling nothing and just getting through the day. You know what I mean? And I feel like that's just such a boring way to live.
Yes. Yes. You felt, so I like to refer to it as just sort of feeling like something important was missing.
Yeah.
From your human experience. Yeah.
Exactly.
Okay, so tell us a bit about the journey off medication.
Well, I did get inspired by meeting you, and then I ordered your book, and I read through it, and I decided, like, I already have a lot of these tools in place. Like, I have a yoga practice, I eat pretty well, I enjoy exercising and being out in nature, and I have a good support system, so I'm like, I can try to get off of this. So I kind of just did it myself as far as, like, weaning down. I didn't even really tell my doctor, and I don't know if that's a bad thing, but I mean, and I would have reached out if something started to feel really wrong or anything like this. But at first, I just started putting a little bit more space, like between, I would take my regular dose one day, maybe skip it the next day, like go, one day at a time, and then just little by little, I was putting more space in between the days that I would take my dose, and then all of a sudden, I didn't take them anymore.
Not what I recommend. No, I'm kidding. I find it amazing because, I never see, in my practice, I never see people like you who can do it this way, right? So obviously I see women who have tried and sort of struggled because that sort of taking it every other day or sort of self-weaning without the help of, a compounding pharmacy personalizing each little, small dose decrease wasn't successful for them. So those are often the women that I work with. And so I tend to really do slow, very, very slow tapers. But I find it fascinating to learn about, a lot of the grassroots work that people are doing. A lot of people are doing this themselves because doctors are not trained in helping patients off of psychiatric medication. So odds are, even if you asked your doctor for help, they would have, I don't know for sure, but they would have either discouraged you and, referred to the chronic illness means, like you are mentally ill, you're always going to be mentally ill, and so you need to take medication like a diabetic needs to take insulin, right? Or if they put trust in you and tried to taper you off, it's possible that, they wouldn't have had the training or experience because we're not exposed to that in our conventional, sort of medical school and residency, and it would have been potentially unsuccessful. But somehow you knew you were ready. You knew what the tools for your own self-healing and support were. You educated yourself in a way that you felt, prepared you. Yeah. And then you did it. So was there anything, did you feel like you had to move through a birth canal, so to speak? Like, was there a dark window? Was there a struggle? Or was it pretty much like waking up from sleep? Was it a gradual sort of emergence?
Yeah, there was definitely, I remember there being a few days that I felt like just a little bit more emotional, and I would start crying over little things and stuff like this. So I guess in that way it kind of felt like waking up because it didn't feel bad. Yes. It was darkness, you know what I mean? It was just stuff was coming up and coming out. So I guess it was kind of like that waking up sort of a thing.
Did you feel, because sometimes, again, I have a skewed experience of women who apparently really need to go through a dark night of the soul, before they can emerge. And it's so helpful even for me to hear about, this kind of process, a bit of a more gentle process, self-directed process. Did you feel like there was something in you, either in your mindset, in your lifestyle, a relationship, something about your professional identity that you needed to shed, or that sort of needed to die in order for you to fully emerge into this lighter space? Or was it really just sort of rainbows and unicorns floating around you?
Yeah, I think not so much like I had to shed anything. I felt like I was just becoming more myself.
Yes.
And as far as with teaching yoga and working with clients, a lot of people day to day, I'm not a therapist, but they tend to come up to their yoga teachers and want to tell you how they feel and what they're going through. And I felt like now I could be kind of more relatable Because before, like I said, every time I wasn't really going through any experiences or feelings. It was just always the same, just kind of like my one level. So now I felt like I could relate to people more so, and I was like just more of myself. I don't know if that makes sense.
It does. And essentially what you're saying is that in addition to enjoying, sort of a more expanded space of maybe joy and pleasure, maybe satisfaction, I'm guessing you're also willing to embrace harder feelings, that grief or pain or struggle or disappointment or frustration, that you understand that this is part of the whole swath of the human
Right.
experience, right? That you don't get one without the other, and that the alternative you opted for 5 years was, a kind of flatness that really felt ultimately like a disconnection, not only maybe from yourself, but from others, interestingly. So
Yeah.
that's a part of the mindset shift.
Mm-hmm.
Yeah.
Exactly. It was just like flatness. And so, yeah, now like when I deal with people telling me just everything they're going through, all the ups and downs, I feel more connected to them.
Yes.
Because I feel the same now, the ups and downs.
Yeah. What do you think was sort of like an early indication that you were on the right track? Like, was there something that you felt in your body? Was it like a physical change, or was it more of this sort of emotional territory you're talking about that you knew you were getting on your path, becoming more yourself, right? Because for the people who struggle in this process, I want to make sure they know what's possible, right?
Right.
So we want to sort of lend them a hand if they're in, sort of those challenging windows. So how did you know that you should stick with this, that you were on your path? What was the early sign?
So I guess I would say, like, even though, like I said, I had some days that I was definitely more emotional, and like I said, I would like sometimes cry for no reason, but those feelings felt better than the flatness. So I was like, all right, this is still more exciting, and I feel more alive than just that flatness, and I had the tools to work through it. And the whole time I never got to a point where I was like, I felt like bad or scared or like I would do harm to myself or anything like this. So I knew I was like always in a safe place.
Yes.
And even as the tough feelings came up, good feelings and tough feelings, they all felt good than not feeling anything at all. So you just start to feel more alive. And I feel like you just want to keep going to connect to more of that.
Any physical changes or shifts over this process, or was it really just emotional for you?
Well, then, like I said, I had gained, like, over a few years, I gained a lot of weight. So then I started, and I would always work out and eat healthy, and I would just keep gaining weight. It ended up being, like, almost 35 pounds.
Wow.
And then when I would ask my doctor sometimes, like, oh, do you think it could be because of the antidepressants? And he would say, no, I don't think so, because Celexa doesn't usually make people gain weight, and you're on, like, a really low dose. So I was like, okay, maybe it's just my metabolism, whatever. But then all of a sudden, like, I think I was off of them for maybe almost 2 to 3 months, and I lost like 10 pounds. And then like all of a sudden, like within like 2 or 3 weeks, I lost like probably like 20 pounds in like 2 weeks. Like it was crazy. So I don't know if it was real weight, if it was like water weight or what it was, but people had like just seen me and they're like, whoa, like what are you doing? Like you look so different. So I'm like, I know that's what it was, because it was as soon as I got off of them, a little bit of time went by. It was like my body kind of recalibrated, and now I'm like back to where I was, my normal healthy weight,
Right.
And I know it's not all about like weight and how you look, but when you feel so uncomfortable in your body that like you don't even want to go out and have like lunch with even like friends or like go on dates or anything like this, like it really starts to prohibit you from doing a lot of things because you're so self-conscious.
It's about coming into, it's a reunion, with your body in so many ways, and this is a part of it, feeling, as you said, more yourself. It's
right.
Incredible. I've told you that I so have enjoyed watching your emergence on social media, because your radiance is so apparent, And radiance is not just an energetic thing, you know, it's everything. It's all of your, you know, 10 bodies, so to speak.
Yeah.
You know, projecting the same image, and it's been incredible. So, okay, so to be clear, what were or was the formal diagnosis that you once had? Do you know?
I don't know.
Were you told that you know, in addition to being, you know, sort of a recovered, you know, addict or substance abuser, let's say, because those are the words we use in psychiatry, were you ever told that you have a diagnosis of depression or some kind of anxiety disorder or anything, any reason that you were on this, Alexa?
No, not really. I mean, literally, like I said, at the same time as I was getting off, you know, just working on my sobriety, I guess he's a psychiatrist because he prescribes medication. So he was like, well, you're obviously self-medicating for some reason by using drugs and alcohol, so we'll put you on antidepressants. Mm-hmm. And I was just, you know, at the time, like, just getting clean or whatever. I'm like, okay, whatever, you know, I'll do that.
Yeah.
It's, like, different than I am now. I wasn't all into yoga and, like, more holistic living and all this. I mean, I had just been, like, abusing my body for 10 years. So I was like, okay, that sounds fine. I'll just take those.
That sounds like the lesser of an evil. Well, what's incredible is that there's just no informed consent there. You know, there was no discussion, and I was absolutely guilty of this as a prescriber. There's no discussion of what are the, you know, short and long-term risks. What is this medication doing? What else could you be doing, you know, instead of that? And it's just treated like some sort of like, oh, why not? You know, better safe than sorry kind of a thing. And meanwhile, you know, for a good chunk of your life, you were living it really not as yourself, you know, not in your own skin. And granted, there needed to be, as you seem very aware, these pillars of self-care, you know, put in place in order for you to have the strength to, you know, move through your own process and your journey with clarity, right? So, you know, if you didn't know that that was an important component, then maybe you would have reverted to using substances. But right, there's a simple sort of program, you know, for self-care and putting it at the forefront of this kind of effort that can really give you back yourself in a powerful way.
Yeah, I don't feel like, I mean, he never like offered alternatives. Like, well, you can take these and that might help. Or you can try just like, you know, do some more exercise and, you know, maybe find like a good group of like-minded people that you want to meet with weekly, you know, just other, like you said, these different pillars of ways to kind of work through whatever I needed to work through rather than just putting that second Band-Aid over it.
Yeah. Amazing. I love this. So I would say just from my, you know, sort of, again, watching you evolve, that you feel more connected to yourself, more connected to others, but my sense is you actually have developed also, or at least reconnected to maybe spirituality, you know, and a deeper sort of, I don't know, sense of wonder maybe about this human experience and the mystical aspects of it. Do you think that's fair to say?
Oh yeah, that's probably the biggest thing that that's like come back into my, or not really come back into my life, because before this I was never really a spiritual person. So it's like the one big thing that I've been discovering and making it a part of my life. And it's exciting. Like once, you know, it's like you kind of have to just accept that like there is this bigger power and that we are having a human experience. Like we are spiritual beings having a human experience. That's just like one quote I keep hearing. When you start to think of things that way, it's like there is just so much possibilities, you know, like our souls never die. This is just one body that we have, if you even believe in all that. But yeah, there's the possibility is just endless, and you feel like you have kind of like a support system, just knowing that there is like the universe behind you or something bigger, whatever it is that you believe in. And again, before that, I think taking the antidepressants and just having myself on that flat line and just getting through the day. Like, I never thought of life in terms of like spirituality and having like this soul. You know what I mean?
I do, and I wouldn't have even 5 years ago, but
Right.
it's become so apparent to me that for women, I'll say specifically, just because that's sort of been my clinical focus, to come into the space of spiritual awakening, divine femininity, sort of personal transformation, coming off of antidepressants specifically seems like a critical part of that process. And I don't think we totally understand why it is, because we don't totally even understand what these medications do or how they interact with human consciousness.
Right.
We barely understand what they do on a neurochemical level. But it's been my observation that coming off of psychiatric medication is a form of self-initiation right now, for people and for women specifically. And, your experience so echoes that. And, it's powerful to me, that it doesn't necessarily have to be some cataclysmic event or some, I don't know, you don't have to be in bed for 18 months, moving through some, as I said, dark night of the soul, that it can be this sort of self-directed, gentle awakening process.
Absolutely.
Sort of being ushered into a more spiritual realm where things just start to make sense in a deep way on a soul level. Your experience is such a beautiful example of that, and helpful, sort of, I don't know, to flesh out the landscape of what this can look like.
Yeah.
So I so thank you for having the courage to share this and for lighting the way for so many people who need to know, that this is possible and that this kind of, self-expansion is available to each and every one of us who feels ready. So
I really hope I can inspire at least one person. That's all worth it.
There's no doubt. And, the fact that you have a healing, practice and that you work as a teacher yourself is no accident either. It's part of how you are going to be sharing your light and, energetically spreading this potential. I think it's amazing. So thank you so much, Alexis. And
Thank you so much.
Thank you.